Hello doctors, today I have learned scalp. Let me explain. It is very high yielding university question. So here is one interesting point that scalp mnemonic is SCALP, layers of scalp. Let's see. First we will see about the extent, anteriorly supraorbital margins, posteriorly external occipital protuberance and superior nuchal lines, and on each side superior temporal lines. On your head you can imagine all the scalp, and let's see the layers of scalp. This is the mnemonic. Skin, superficial fascia, dense connective tissue, C for connective tissue. Then a deep fascia, epicranial aponeurosis, A for aponeurosis. Fourth one is loose areolar tissue. Fifth one is pericranium. These upper three layers are the surgical layers of scalp, or it's called as a scalp proper. Let's see one by one. First one is skin. Skin is hairy, contains sweat glands and sebaceous glands, adherent to epicranial aponeurosis through dense superficial fascia. So, second one is superficial fascia. It is more fibrous and dense in center, and it contains many blood vessels of head, binds skin to epicranial aponeurosis, and occipitalo-frontalis muscle is present, which have two bellies from front and back, occipital belly and frontal belly. You can see in diagram. Wait for that. First we will see the layers of the scalp. Here are the layers of the scalp that contains 5 layers. You can practice the diagram for 1 to 2 times. It is so simple diagram. Let's see. Let's zoom it. First one, skin, that contains hairs and sebaceous glands. Second one is connective tissue. That next one is epicranial aponeurosis, and fourth one is loose areolar tissue, and fifth one is pericranium, and next one there are the veins that's called as emissary veins. They have more importance because of their features. Let's see. Wait for that. Let's see about the superficial fascia, that more fibrous and dense in center, and many blood vessels are present, bind skin to the epicranial aponeurosis. Also, occipitofrontalis muscles are present, occipital belly and frontal belly, and that inserts in the epicranial aponeurosis. Let's see. This is the diagram. These are the bellies of the occipitofrontalis muscle. From front, frontal bellies, and from occipital region, occipital bellies are present. So, next one we can see epicranial aponeurosis. It is the freely movable on pericranium along with adherent skin. Anteriorly receives insertion of frontalis, posteriorly receives the insertion of occipitalis, attached to external occipital protuberance and highest nuchal lines. For studying the scalp, you should remember this skull anatomy, means osteology of skull. You can easily write any theory about that. And next one, on each side epicranial aponeurosis attached to superior temporal line, and thin expansion is attached to zygomatic arch. Next, fourth layer, loose areolar tissue. Anteriorly, it extends into eyelids, no bony attachment to frontalis muscles, and posteriorly to highest and superior nuchal lines on each side temporal lines, and give passage for emissary veins. It is important feature for loose areolar tissue, and emissary veins connect epicranial veins into intracranial venous sinuses. And last one is the pericranium, loosely attached to cranial bones, firmly adherent to sutures, and sutural ligaments bind pericranium to endocranium. So 5 layers are completed. Next we will see about the arterial supply for the scalp. You should remember, from front of the auricle it is the ear, and front of the ear and back of the ear, that's called in front of auricle, and behind the auricle there are in front 3 arteries, and back behind the auricle 2 arteries: internal carotid artery, ophthalmic artery, and branches of the ophthalmic artery, and one branch of external carotid artery. Here are 2 arteries behind the auricle, 2 branches of the external carotid artery, posterior auricular and occipital artery. Let's see the venous drainage. There are 3 pathways: facial pathway, retromandibular pathway, and occipital pathway. Here you can remember as a pathway, not not that much difficult, but you should remember as a supratrochlear vein, supraorbital vein, form angular vein, then facial vein, finally internal jugular. Here finally is subclavian, and here also finally suboccipital venous plexus. 3 pathways are important. And then the emissary veins, let's see its features. It connects the extracranial vein with the intracranial venous sinuses to equalize the pressure. Valveless extracranial infection may spread through these veins to intracranial venous sinuses. It is so fetal, and the parietal emissary veins passes through the parietal foramen to enter the superior sagittal sinus. And fifth one is the mastoid emissary veins passes through mastoid foramen, through the mastoid foramen to reach sigmoid sinus. Emissary veins are 6 marks or 3 marks important questions. And diploid veins, another types of veins, starts from cancellous bone with the 2 tables of skull. These carry newly formed blood cells into general circulation. These are the 4 veins each side: for frontal, anterior, temporal, posterior temporal, and occipital diploid veins. Next, we will see the nerve supply of the scalp. Scalp and temple supplied by the nerves on each side. 5 enter the scalp in front of auricle and remaining behind the auricle. Same like arteries, you should divide in front of auricle and behind the auricle. 5, 5 on each side, total 10 on each side. This is the line, and the arteries here 3 and 2, and here 5 and 5 nerves are present. So these are the 5 nerves present in front of the auricle, and here are the 5 nerves behind the auricle. You should practice the diagram 2 to 3 times. You can easily remember that, don't worry. Then the lymphatic drainage. Anterior part of the scalp drains into preauricular parotid lymphatic glands, and posterior part mastoid lymph nodes or occipital lymph nodes. By name itself you can remember. Then the final is a clinical anatomy. First one, black eye, it is so important clinical question. And collection of blood in the loose areolar tissue causes swelling, and this results in black eye. Posterior limits of such hemorrhage is not seen. Let's see one image of the black eye. See, This is the black eye. It is because of the blood, it is the blood accumulate in the loose areolar tissue of the scalp. There is no hemorrhage, but it can be fetal. And then next one we will see about the sebaceous cyst. It is common site for this due to abundance of sebaceous glands. And third one is safety valve hematoma, fracture of cranial vault and escapes of the intracranial hematoma into subaponeurotic space. This is the space spread of the blood in the fourth layer of brain is not compressed, thus is called as safety layer. Subaponeurotic space is also called as the safety layer. Then fourth one is dangerous area of the scalp. Layers of the layer of this loose areolar tissue is the dangerous area because emissary veins connects of these layers with dural venous sinuses. Hence, infection of loose areolar tissue spreads to dural venous sinuses. That's called as thrombosis. It is fatal. And healing of unusual scalp rich in anastomotic vessels. And finally, this is the diagram for sebaceous cyst. So, in just 10 minutes, we completed the scalp anatomy with clinical anatomy with easy explanation with one mnemonic. If you like it, share, like, and subscribe. Thank you.